Hi, I'm Emily McDonald and I'm doing a speech on dental hygiene. I currently work at a dentist office. Children come in every day to get their teeth cleaned and their parents are always right there beside them. One situation happened where a little boy was getting a routine checkup exam after he finished getting his teeth cleaned and they found 6 cavities. We asked the mother if she was helping him with his teeth and she said she hadn't been watching him, resulting in poor home care. Not only is brushing and flossing something you need to do twice a day, but if kids do not receive the correct instruction when young and don't take care of their primary teeth, it can result in a lot of complications with their permanent teeth once older. I want people to understand why dental hygiene is important starting from a young age. There are many parts to the tooth structure. Each tooth consists of 3 main parts: the crown, the neck, and the root. The crown is the visible part of the tooth, and the protective layer called enamel covers the crown. The neck is the area of the tooth between the crown and the root. The root is the portion of the tooth that extends through the gum into the bone of the jaw. All of these aspects come into play as soon as the baby is born. Babies have 20 primary teeth that erupt at about 6 months of age and fall out at various ages: 4 second molars, 4 first molars, 4 cuspids, 4 lateral incisors, and 4 central incisors. Primary teeth are important when the child's development for their mouth because primary teeth help them chew, speak, and smile, and also help hold space in their jaw for their permanent teeth to come in. When primary teeth aren't taken care of, early childhood caries can occur. Tooth decay can happen when the baby is put to bed with a bottle or when they have prolonged exposure to drinks that contain sugar, especially in the case where the bottle is used as a pacifier for a fussy baby. It is a disease that can also be passed from mother to infant by saliva in the instance of the mother using their mouth to clean a pacifier to also licking the spoon while feeding the baby. If your infant or toddler also lacks an adequate amount of fluoride, they can have a higher risk of tooth decay. Decay can also result in fillings or extractions of the primary teeth. Unfortunately, when you have to extract primary teeth before the permanent teeth are fully developed, it can cause the permanent teeth to drift into this empty space and make it difficult for older adult teeth to find room to come in, and this can cause crowded or crooked teeth. By 21 years old, all 32 permanent teeth should have erupted. You should have developed 4 third molars, 4 second molars, 4 first molars, 4 second bicuspids, 4 first bicuspids, 4 cuspids, 4 lateral incisors, and 4 central incisors. One of the biggest issues we see in our office in adults is plaque and tartar buildup. This is what people mainly think isn't a big deal, but it can result in cavities, gingivitis, periodontitis, bad breath, abscesses, receding gums, and other systematic health problems ranging from preterm labor and heart disease to diabetes. There are even studies linking gum disease to forms of dementia. These are your permanent teeth and cannot be replaced unless done so by restorative procedures like amalgam and composite fillings, crowns, bridges, root canals, or implants. Parents often don't know when you should start taking care of a child's mouth. For infants, you should start cleaning their mouth during the first few days after birth by wiping the gums with a clean, moist gauze or washcloth. As soon as teeth appear, decay can occur. After the first tooth comes in and no later than their first birthday, you should take them for a baby checkup at the dentist. For children younger than 3, you should start brushing their teeth right at their first tooth breaks through with a rice-size amount of fluoride toothpaste. From the ages 3 to 6, you can use a pea-size of fluoride toothpaste. You should always supervise your children brushing their teeth until comfortable to ensure that they use the proper amount of toothpaste, time, and good home care routine. There are many ways to help prevent and or decrease the rate of cavities, plaque, and tartar buildup. You should floss at least once per day. It is best to floss before brushing because it removes plaque from between the teeth and on the gums. Brush your teeth twice a day for 2 minutes, each with a soft bristled toothbrush and fluoride toothpaste. It is always good to replace your toothbrush every 3 to 4 months or sooner if needed, especially if you've been sick. Avoid sweets and sweetened drinks. These can increase your risk of cavities. If you do eat or drink sweets, brush your teeth as soon as possible. Also, try not to smoke. Smokers have more teeth and gum problems than non-smokers, and make sure you schedule your regular checkups with your dentist. Many dentists recommend having their teeth professionally cleaned every 6 months. As a parent, if you are prone to tooth decay or gum disease, your kids might be at higher risk as well. So sometimes even the best brushing and flossing habits can't prevent a cavity, but the proper dental care and attention from the start will help. This ensures children learn to properly take care of their teeth when they become adults and helps prevent things listed above. Even though it is a challenge to find time to take kids to appointments, ultimately it will help you and them with overall health.